Did you know that there are situations where people come into the emergency room after putting objects on their penis that end up getting stuck? It may sound surprising, but it really does happen. I'm Dr. Rena, a urologist and pelvic surgeon, and today I want to talk briefly about something known as penile strangulation. Penile strangulation refers to placing items around the penis that later become trapped. You'd be amazed at the variety of objects people have used. Things like wedding rings, plastic bottles, nuts, bolts, pieces of pipe, and many others. It might sound unbelievable, but yes, this actually happens. So how often does it occur? In medical literature, there have been around 60 documented cases since the 1700s. Of course, the real number is likely higher, since not every case gets reported. You might wonder why someone would do this in the first place. In many cases, it's due to curiosity. People experimenting with different sensations for sexual pleasure. Others may try it to achieve a firmer erection for intercourse. There are actually medical devices designed specifically for this purpose. If you're considering something like this, I strongly recommend using medically approved vacuum erection devices. These come with proper constriction bands placed safely at the base of the penis, along with a vacuum system to help create an erection. This is a much safer option. What happens with unsafe objects is that they restrict the penis and cause swelling beyond the point where the object is stuck. As swelling increases, blood flow begins to decrease. Over several hours, the swelling worsens, making it more difficult to remove the object. If it continues for days, blood flow can be severely reduced. In some cases, it can even block the urethra, the tube used for urination, making it hard to pass urine. This makes it a very serious condition. I've personally encountered this situation twice in my career. One of the most concerning aspects is that it often happens when someone is under the influence. They may fall asleep or pass out and forget the object is there. When they wake up, they can't remove it. Because of embarrassment, many people delay going to the emergency room, but the longer you wait, the greater the risk of damage. If you ever find yourself in this situation, please don't delay. Seek medical help immediately. Acting quickly makes it easier for us to remove the object and restore proper blood flow. Interestingly, this can also occur in children. In those cases, it's usually due to hair or threads getting wrapped around the penis. This could be hair during diaper changes or fibers from clothing. So it's important to check for this when changing diapers for baby boys. So what happens when you arrive at the emergency room with this issue? We have several methods to help reduce swelling. Sometimes we use special wraps to bring the swelling down, allowing us to remove the object. In tougher cases, especially with metal items, we may need to use tools like a jiggly saw to carefully cut it off. This can be uncomfortable and understandably frightening. The good news is that in most cases, people recover within 24 to 48 hours after the object is removed. However, there have been rare cases of severe complications, including full penile necrosis, where the tissue becomes black and cannot be saved. That's why this situation is extremely serious. So please, don't wait if this ever happens. Get medical help right away. And more importantly, avoid putting objects on your penis that aren't designed for that purpose. If you do use devices, make sure they are safe, flexible, and easy to remove, not rigid items that can get permanently stuck. That's all I have for today. Thank you so much for watching, and always remember to take care of yourself, because you truly matter.